the frontal bone, the parietal bone, the temporal bone, the temporal mandibular joint, the squamous part of the temporal bone, the mastoid process, the styloid process, the external acoustic meatus, the occipital bone, the external occipital protuberance, which secures the ligamentum nuchae and anchors many back and neck muscles. We then have the petrous part of the temporal bone, which is here, and this is where the houses the middle and internal ear cavities. The internal acoustic meatus we cannot see unless we take apart the skeleton model, but in this part, cranial nerves 7 and 8 pass through its opening. We then have the sphenoid, and then we have the if you look in there, the superior orbital fissure right there, and the cranial nerves 3, 4, and 6 pass through its opening. We then have the greater wing of the sphenoid, which is here, and the optic canal all the way in the back there, and the optic nerves pass through that. The sella turcica, which we also cannot see from the external view, but the pituitary gland sits in its fossa. This is the ethmoid bone, and internally we have the crystal galli, which helps secure the brain in the cranial cavity, and the cribriform plate, where the filaments of the olfactory, which is the smell nerves, pass through its openings. So the coronal suture is formed by the 2 parietal bones and the frontal bone. Then we have the sagittal suture, which is here, and it's formed by both parietal bones. We then have the lambdoid suture, which is here, and it is formed by the parietal bones along with the occipital bone. And then we have the squamous suture. Not really showing here on the skull. It should be about here, and it is where the parietal bone and the temporal bone meet. We have the maxilla here, which also has the alveolar process, which holds the teeth in place. We have the nasal bone here. The zygomatic bone is here, and the 2 bones that form the zygomatic arch are the zygomatic process and the temporal process of the zygomatic bone. We have the vomer, which is here. We have the inferior nasal concha, which is down below, and this bone forms part of the lateral walls of the nasal cavity. We have the mandible, and also with the mandible we have the mandibular angle, the mandibular ramus, the mandibular condyle, the mandibular notch, which is here, the coronoid process, which is there. The first curve is the cervical curvature. The second is the thoracic curvature. Then the lumbar curvature. And lastly, coming out here, we have the sacral curvature. The primary are the thoracic and the sacral. And the secondary are the cervical and the lumbar. There are 7 cervical vertebrae. The first one is the atlas. Let me try to zoom in that. The atlas. And this bone from the superior aspect articulates with the occipital condyles of the skull and allows you to nod yes. What's unique about the transverse process of the cervical vertebrae compared to those of the thoracic and lumbar is that they have a transverse foramen which vertebral arteries pass through to service the brain. The thoracic vertebrae has 12 vertebrae, and the spinous process would be here. The transverse process is here. The intervertebral foramen would be in between there. And the spinal nerves from the spinal cord passes through there. Then this is the body or centrum, and the position of the intervertebral disc would be just underneath each one in the right below the foramen. The lumbar vertebrae are here where the spine curves back inward. And there are 5 of those vertebrae. The sacrum is here, and there are 5 fused vertebrae that form that. And then we have the coccyx, which is this little tailbone here. Let's try to zoom in on that. Right there. For the ribs 1 through 7 are the true ribs, or the vertebral sternal. And then we have ribs 8 through 12, which are the false ribs, or the vertebral chondral. And then these ones down here at the bottom here, these last 4, are the floating ribs. Then we'll go up. Here you can see the head of the rib. This is the neck of the rib. And then the curve here will be the tubercle of the rib. And the ribs articulate with the vertebrae from the demifacets of the thoracic vertebrae. And they receive the head of the ribs. As you can see here, this one kind of came apart to show an example of how they connect. And this one is one that's connected together.